Good morning, viewers. Welcome to CNBC News Channel with me, participant number 34. We have news from all around the world, and for today's headline, we will be talking about U.S. COVID cases rise to pandemic high as Delta and Omicron circulate at the same time. U.S. COVID cases have hit their highest level of the pandemic as two highly infectious variants circulate throughout the country, and health officials urge Americans to get vaccinated and boosted against the virus. Nationwide daily new cases were at a record 7-day average of more than 265,000 as of Tuesday, according to data compiled by Johns Hopkins University, surpassing the previous high mark of about 252,000 average daily cases set on January 11, 2021. The fresh pandemic peak comes as the Delta and Omicron variants are spreading simultaneously. The previously dominant Delta variant was already driving U.S. case counts higher this fall before the emergence of Omicron, which is contributing to a near vertical rise in daily new cases. About 75,000 Americans are hospitalized with COVID-19, and the country is reporting more than 1,500 daily deaths. Though both figures are rising, they are lower than when the last daily case record was set nearly a year ago, before COVID vaccinations were widely available. Hospitalizations topped 137,000 at that point, according to a 7-day average of data from the Department of Health and Human Services, and Johns Hopkins data shows the average death toll was more than 3,200 per day. Roughly 62% of the U.S. population is fully vaccinated with 2 doses of the Pfizer or Moderna shots or 1 dose of the Johnson & Johnson vaccine as of Tuesday, according to the Centers for Disease Control and Prevention. U.S. health officials have warned that the risk remains highest for the unvaccinated and are pushing Americans to get a booster dose to better protect themselves against Omicron. It's got over 50 mutations, and because of those mutations, just being vaccinated with 2 doses may not be enough, CDC Director Dr. Rochelle Walensky told CNBC's The News with Shepard Smith last week. And so, we really do need people to get boosted in order to increase their protection, especially against severe disease and death with Omicron. In the United States, Omicron represented 59% of the Queen's COVID cases, while Delta represented 41% last week, according to CDC estimates. While the global scientific community is still gathering data on the new variant, which was first detected in Southern Africa in late November, there has been some encouraging early news. Real-world studies from South Africa and the United Kingdom suggest that people infected with Omicron develop more mild illness compared with Delta. Pfizer and Moderna have each said that a 3rd dose of their mRNA COVID vaccines appears to provide significant protection against Omicron, though a 2-shot regimen has been found to be less effective against infection. A higher peak can further overwhelm the system for other people as well, said Dr. Bruce Wiley, a professor of health policy and management at the City University of New York School of Public Health, explaining that fuller hospitals would make it harder to treat those with heart attacks or cancer or who, for example, got into a car accident. And that's the end of our news today. I'm participant number 34 and all crew of CNBC News Channel signing out. See you next time and have a nice day.